Dickinson Hospital, and I am joined by the Women's Imaging Supervisor, Deb Grandmont. Deb, thank you so much for having us.
My pleasure.
And we are going to be talking about screening mammography today. So for people that may have not started with a routine mammogram, when is a good time to begin?
Well, ideally 40 years of age is the recommendation, but that is becoming an age that has been stretched out a little bit with different regulation changes or recommendations. So it's not a black and white answer. It's more gray. If you have a family history of breast cancer, you should start at age 40 and continue having mammography annually. If you have no family history, then you might be able to stretch it out to 45 or 50, realizing that younger women have more aggressive breast cancer. So that's a decision the patient has to make.
So what is the process like for people that may not know what undergoing a mammogram is like? What is the process like? Is it invasive? Is it painful?
Well, it's uncomfortable, but it's not really painful. So the patient will come in, we'll ask them a bunch of questions in regard to their breast health history so that we know, the radiologist knows what their recommendation is going to be for that particular patient. Then we'll have the patient change, and then we'll bring them in to do their images. There's always two pictures on each breast. The first picture is a front one and then a side one. And there's some pushing and pulling, and as the technologist, the mammographer positions you, and then this compression device comes down onto the breast. Compression is really important because it separates the breast structure.
Okay.
So you can eliminate overlapping breast structures with compression. And the overlapping breast structures are what many times patients come back for.
So next, let's talk a little bit about the 3D mammography.
Okay.
This is a new technology that has come out. What is the main difference between the 3D and the 2D?
So with the three-dimensional technology, we can scroll through the image 1 millimeter at a time. So all that overlapping breast structure that people used to have to come back for repeat imaging, we're able to really figure out, is it overlapping or is there something really brewing in the breast?
Now, is this much better than the two-dimensional mammography, or do they kind of go in cohorts? You need the 2D?
You have to have the two-dimensional. You can't just have the 3D. That's a regulation. But it's important that patients know it is a little bit more radiation. It's 1.4 times the radiation. That's really important. You want to be open with that. But what we get with that information is so valuable for the radiologist to read with more certainty. We're looking for every millimeter through the breast. You don't get that with the two-dimensional mammogram. And also with the two-dimensional mammograms, patients come back for additional imaging or repeats. We've reduced our patients coming back by 30%.
What is the next step for people if they have already gone through the mammogram process and they find something abnormal?
So traditionally, if a patient's had the screening mammogram, the radiologist might see something on the mammogram, in which case we would make a phone call to the patient for them to come back in for what is called a diagnostic mammogram. And during that time, we will do additional images, and they're not the same ones of the routine ones. They're special pictures that might zone in to a certain spot of the mammogram. The radiologist checks those pictures while the patient's here, and patients get their results before they go home. And that's going to help them to figure out if there's something really there. It's important to patients to know that just because you get called back for additional images doesn't mean that there's something really bad. It's just that we need to figure it out. Is it bad, or is it just the evolution of the breast? Only about 15 to 20% of mammograms that come back for additional images end up going on for further follow-up. Follow-up might be a 6-month follow-up. Let's look at it again. And it also might be you need to have a biopsy.
It's never too sure to be sure, you know.
Right.
To get that extra screening is so important, especially when going through a time like this. It's very nerve-wracking.
Every woman that comes for a mammogram is anxious, myself included. No matter if you don't have a family history or you have nothing wrong, you still have that little inside of you that makes you think, am I going to be one of those women? Am I going to find an abnormality? So
absolutely,
yeah.
Because as we were talking with Diane, breast cancer is very prevalent in society today, so it is a very nerve-wracking process. So how do you guys here at Cooley Dickinson, ease the process for women a little bit?
Well, I think that to have really experienced mammographers that are friendly and know what they're doing, I mean, that's really important to the patient, that you feel you have a really good relationship with your mammographer so that you can feel that you can be open with some pretty sensitive questions that we have to ask you.
Sure. And lastly, for people that are concerned about radiation, what kind of radiation comes with mammography?
It's a very low dose radiation, but I think that radiation is cumulative, so I really understand people's concern about it. But if you go outside in the sunlight and you get more radiation than you do from a mammogram.
Deb, thank you so much for having us. And for more information, you can visit them online at cooley-dickinson.org.